we're doing another medical video. So we're starting with this Cushing syndrome. Now, what is Cushing syndrome? It is related to the hormone cortisol. Cortisol is a steroid hormone produced in our body by the adrenal glands. And whenever there is a stress in our system, and whenever we are stressed about something, cortisol is released into the bloodstream. All right. Now, what are the causes of Cushing syndrome? The causes are 1, 2, 3. Number 1, the most important and the most common cause. Now, of course, there's increased cortisol due to a variety of causes. Now, what is the first cause? Is exogenous glucocorticoids. For instance, whenever we have exogenous glucocorticoids, there will be adrenocorticotropic hormone, ACTH, will be decreased, and then that will lead to the bilateral adrenal atrophy. Now, what is bilateral adrenal atrophy? It is basically, bilateral means both, adrenal means the adrenal glands, and both the adrenal glands will atrophy, which is shrink in size, alright, because the ACTH has decreased. Now, another cause is primary adrenal adenoma, hyperplasia, or carcinoma. Of course, the benign tumors or the cancers can cause, again, decrease in the ACTH level, which is very, very important here. And then we have the atrophy of the uninvolved adrenal gland. So it could be not bilateral, but one adrenal gland is involved here, and that will result in the decreased ACTH. Then we have the third cause, which is ACTH secreting pituitary adenoma. Now, that is also known as Cushing's disease. And then we have the paraneoplastic ACTH secretion, for example, small cell carcinoma or bronchial carcinoids. And then we have the bilateral adrenal hyperplasia. Again, both the adrenal glands will get affected here, and there will be hyperplasia, which is like this is not as simple as inflammation, but it is basically the cells will increase, and therefore it will enlarge. There's enlargement of the organs here, all right? And then we also have the Cushing disease is responsible for the majority of endogenous causes of Cushing syndrome. So because of Cushing's disease, we will get the Cushing syndrome. Now, what are the findings? Now, findings are really important here. We have moon fasces. That is the highlight of Cushing syndrome. What is moon fasces? The first thing we have is metabolic syndrome. We'll have hypertension, hyperglycemia, and hyperlipidemia. Hypertension is, of course, increased blood pressure. Hyperglycemia is increased blood sugar levels, and hyperlipidemia is increased lipid levels, their cholesterol levels in your blood. And then we have the obesity. Now, it is truncal weight gain. There is wasting of extremities, round moon fasces, alright, moon-shaped face, dorsocervical fat pad, which is also known as buffalo hump. So these are the findings. And then we have another O is for osteoporosis. Osteoporosis is a very common disease among females mostly, but also happens in males. And if it is metabolic or endocrine, then you know the cause for it. So if it happens into younger women, and their vitamin D levels are normal, then it has to be another cause, and usually it is a hormone issue. Alright, and then we have N is neuropsychiatric issue. Now, neuropsychiatric issues are also very common in Cushing syndrome. There is depression, there's irritability, and there's anxiety. And let's not rule out all of those issues as well, because that is also very important in diagnosing. Then we have facial plethora, we have androgen excess, of course, it's an androgen excess, cortisol is increased, you will have acne, you have hirsutism. Then again, we will have cataracts in your eyes, you can have immunosuppression, your immune system will go down, and that will greatly affect your ability to, do your physical activities. You'll feel fatigued, right? And then we have ecchymosis, which is easy bruising, you will get bruised very easily, and you will not know the cause for it. You will be like getting these purplish bruises on your skin, and they won't go away for a long time. Then we have skin changes, there's thinning, there's striae formation, and then there's hyperpigmentation, okay, on your skin. So all of these findings sort of reveal the Cushing syndrome, but for diagnosis, we need the lab test. So we have the screening test. We'll have increased free cortisol level in 24-hour urinary analysis. Now, if it is positive, if you do get cortisol level, and if there's increased late night salivary cortisol, and after the suppression with dexamethasone 1 milligram, that is the low dose dexamethasone test overnight, we still have salivary cortisol and we have free cortisol in urine. Both these tests are positive. We have the Cushing syndrome that is diagnosed. Now, Once these tests come out positive, we have diagnosed Cushing syndrome. Now again, we have to measure certain other things. We have to measure the ACTH hormone. Why? Because ACTH is directly related to the cortisol. Now we have to measure now we have to know the cause. So we have to find out whether the serum ACTH is increased or decreased. If it is suppressed, then it is an ACTH independent Cushing syndrome, and we will get the exogenous glucocorticoids or adrenal tumor, and therefore we need to consider the adrenal CT to confirm. But if it is elevated, then it is an ACTH dependent Cushing syndrome, and therefore we need to do two other tests: the high dose dexamethasone suppression test or the CRH stimulation test, which is cortisol releasing hormone. Now, if the high dose dexamethasone test comes out positive, then it is diagnosed with Cushing disease, and therefore MRI of the pituitary to identify the adenoma, and the CT of the chest or abdomen or pelvis. Alright. Again, if it is not positive, then we have the ectopic ACTH secretion, right? The organs are separate. Again, we have the CRH stimulation test. If there is ACTH and cortisol is increased, then we will diagnose it with Cushing disease, and therefore we'll get the MRI of the pituitary gland to identify the adenoma, and we'll also get the CT of the chest, abdomen, pelvis to identify the tumor. Now, if the CRH stimulation test is not positive, then again we have ectopic ACTH secretion, and therefore again CT chest, abdomen, pelvis, we don't need to get the MRI of the pituitary gland. So there we have it. We have Cushing syndrome. If there are any queries, please let me know. Please do like, share and subscribe to my YouTube and TikTok channel. Take care. Goodbye.